All right, we are doing lab activity number 4 today, which is instrument grasp, dental mirror, anterior fulcrum, and finger rest. All right, so the first thing we're gonna do is we're gonna verify our correct grasp with our CI. All right, she has a modified pen grasp, it looks okay. We're gonna demonstrate the following areas of a dental mouth mirror as described on pages 92 to 94. All right, we're doing indirect vision. All right, we're gonna do a retraction of the tongue. Okay, now we're gonna show you retraction of the lips and cheek. All right, now we're gonna show you indirect illumination. And I like to use this when I am doing the linguals of quad 2. See how that light is bouncing on those teeth? It makes it so that I can just see better. It's a little bit brighter. All right, and last one, we're gonna show you trans illumination. A lot of times you see this the best right behind the front 2 teeth. See how bright they just got? It's a great way to show cracks or like fissures in the tooth. Okay, we're gonna demonstrate intraoral fulcruming techniques. There's a chart on page 113 that you guys can reference. And you're gonna show your CI, the correct use of your grasp, your fulcrum, the location that you can be 1 to 4 teeth away and out of the line of fire, and a rest. You can rest on the same arch. Incisal or occlusal surface. Do not rest on a mobile tooth or a tooth with a carious lesion.
So if I'm working on tooth number 9 on the surfaces towards me, I'm going to fulcrum on my ring finger. I'm going to have it straight up and down. And I'm going to be on the incisal edge of the tooth next to it or a couple of away, not too far. So I'm going to make sure that my finger, my middle finger is towards the end. And I'm making a C shape with my other fingers. So this is how it'd work on this tooth. I'm not going to be crossed over where I could cut myself, and I'm not going to be super far away where I'm doing a wrist injury or anything like that. I'm going to be closer and up on my fulcrum.
So now we're going to demonstrate the fulcrum techniques with a non-dominant hand while holding the mirror. So we talk a lot about fulcruming when we are doing instrumentation in the mouth, but we need to make sure that we are also fulcruming with the non-dominant hand when we're holding the mirror so that we don't get wrist fatigue.
So today we're going to practice the technique for establishing finger rests using correct grasp in each of the following areas. Note, you should use a mirror in your non-dominant hand and a saliva ejector in your dominant hand. So we're going to show mandibular facial surfaces toward.
Now it's hard to see my fulcrum, but I am moving my fulcrum as I work around the mouth to keep 1 to 4 teeth away.
Mandibular lingual surfaces toward.
So I'm retracting the tongue. I'm up on my fulcrum on these anteriors.
Mandibular facial surfaces away. Mandibular lingual surfaces away.
And if you'll note, she's cleaning the lingual surface, but she is fulcruming on the buccal side.
Patient turn.
Maxillary facial surfaces toward.
Also here, even though I'm working on buccal, I am fulcruming on the lingual for these posterior teeth.
Maxillary lingual surfaces toward. Facial surfaces away. Maxillary lingual surfaces away.
So this is a harder tooth as well, so I'm gonna fulcrum on the buccal surface while I'm working on the linguals. So I'll be back here and I'm working.